You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV, and I'm your host, John Tassoni. Thank you for joining us today. Narcan, please get it. It's at CVS, it's at URI. Get it, it saves lives. You can put it in your purse, you can put it in your car, but take it in at night because it's weather issues. But Narcan, it saves. Linda Hurley is my guest today from Kodak. She's got some exciting news to tell everyone today. So Linda, welcome and thank you for joining us today.
Thanks, John.
So tell us the news.
So, Kodak has opened its new site at 45 Royal Little Drive in Providence. It has taken a long time and we're very grateful. As I guess is the case, but we were running about 22 months behind, so this is really, really a lovely announcement. We opened Thursday, and we already have had a really strong response.
Great news.
Yeah. So what we do at Royal Little and what we're going to grow into doing at Royal Little is a fully integrated community health care center. So we're providing psychiatric care or mental health services. Mm-hmm. We're providing a social service center where people can come. Neighborhood health care is renting space from us. They're going to be there the whole time we're there. Department of Labor and Training has space with us for career path development, not just for other pieces around what the DLT does, but if you have a problem, say a problem with your workers' comp, you can come to our site and they will be there to be able to help you with that. The HOPE initiative, in conjunction with the Department of Corrections, is providing reentry services and also crisis services when an EMT goes out for overdose. Mm-hmm. And we have, there's really, I'm extremely excited. We've invited the Department of Human Services to be in the building to, if someone has trouble getting some kind of entitlement like SNAP or WIC or you need something, the people are going to be right there to help you. The center's going to be there to help the individuals, not to make you go to this bus and that bus or down the street or over, like right here, one-stop shopping, as Senator Reid has called it, So
speaking of Senator Reid.
Yes.
I know he needs no introduction, but we want to give him kudos. Him and Senator Whitehouse for the amount of money they brought into Rhode Island to set up this facility.
They've actually, Senator Reid and Senator Whitehouse have provided the primary amount of money through 3 consecutive years of earmarks for this center. I am forever grateful to them. Yeah. I just had a conversation this morning. We're going to have a ribbon cutting probably in early spring because that's going to give us the time. We have had delays. So again, that's why we're so grateful that we opened last week. So we're providing the fully integrated, which is important, the behavioral health, medical, and the medical help, I'm going to read a little bit because primary care, treatment for infectious disease, HIV, Hep C. We all know now that syphilis is really abounding, and it is a very insidious strain. So please be careful, anybody. Don't take that for granted. And HIV, we're providing reproductive health care. We're providing obstetrics through women and infants, gender affirming care. As you know, I spoke with Dr. Chan and Dr. Amy Nguyen this morning about that, healthy aging, and most importantly, our medical one of our medical specialties is the treatment of substance use disorders. Mm-hmm. So all the medicines. So We are an opioid treatment program that is a specialty within the context of our fully integrated community health care center, as opposed to methadone clinic that gives you everything, so to speak. This is much broader, much broader.
How many people do you see Kodak serving in that facility?
That question's been asked to me many times today. I cannot begin to project it. I think easily 1,000.
Wow.
Yeah, easily 1,000 by June, and I don't know how many more. Because we have the social service center, we have the medical center, we have the mental health center, and we also are collaborating. We're in a formal partnership with East Bay Recovery Support Center. So we have a recovery support. We have a peer recovery center right here, right there in the building.
Yeah.
You know, the group room, the relaxation space with private offices. It's a whole suite for peer recovery.
Wow.
Yeah. And then we also are having a pharmacy, a community pharmacy. You know, of course, we're an opioid treatment program, so there's a pharmacy attached to that, but this is different. This is, I'm going to use this pharmacy, you know, it's just a regular community pharmacy.
Now, who will operate that? Or is it a regular pharmacist or two pharmacists, or is it URI? Is it?
No, it's not URI. It's going to be a pharmacy. There's two. We're not quite sure yet which. One of the reasons that we asked to delay the ribbon cutting is so that we could have everything in place at that time, you know. So, but we're definitely having a community pharmacy.
Well, it makes sense. It makes sense because, you know, if you have that many people, and you don't want them traveling all over the place to get their medications, especially if you're looking to do primary care, and little Johnny needs medications, and then you put little Johnny on the bus. He's got to go on the other side of the city of Providence to get his medication. Doesn't make sense.
No, and this is really the reason that Senators Reid and Whitehouse really adopted
vision. They had vision.
Yeah, and just adopted what we were looking to do, to be able to provide all the services that somebody needs under one roof. And I mean, this is evidence-based.
Yeah.
You know, I think there was one study Johns Hopkins did where people went, even just the building next door, X amount of people dropped off. If you had to go to the next block, X amount of people dropped off. None of us are, as they use in the medical world, they use the word compliant. I don't love that, but none of us are compliant. The more difficult it is to be compliant with a medical recommendation.
It's Rhode Island.
Yeah.
You know, people don't like to drive. They don't like to walk. They want everything in one central location. Do you ever see Kodak possibly getting another building within that 45 Royal Little Drive, about putting other things in there?
I have had that vision. It doesn't mean that my staff and my board have had that vision.
Well, we're going to talk more about that when we come back. We're going to take a break. You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back with Kodak and Linda Hurley after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Linda Hurley from Kodak is here with their huge announcement today about 45 Royal Little Drive, all encompassed, all huge. Huge piece.
Yeah,
so
we're excited.
Linda, thank you for joining us. So thank you for your vision. I don't think a lot of people realize that when you think of something, that you can put it on a piece of paper, to roll it out to become as big as it's going to be when it's done. And I know that you have other visions of other sites within that facility, and we can make a healthcare mall, I'll call it.
Exactly.
Healthcare Mall. But I want to talk to you a little bit about staff. You know, there's been a lot of problems with getting staff and getting a feeder program into mental health staff. After COVID hit, people disappeared. Where are you with staff?
We're actually doing pretty well with staff. There are certain departments, however, in which we are having problems. It took us a long time to recover. We were short-staffed for nursing, for counselors, for everybody. And we've been able to build that back, being extremely innovative. My leadership team is they're actually brilliant. So that has worked, but there's certain areas, like we were speaking earlier about mobile treatment,
Right.
because this one-stop shop, if you will, or
The mall.
the mall.
The
Yeah,
mall.
I was thinking of your, we're pretty well staffed there. And that was but it was an access issue that was the start of the vision. Like, how can you get people what they need? And they have trouble getting to what they need. So put it all together and make it easier, right? The other piece of access is going to individuals in their community with a culturally congruent staff. Okay. Now, that's been a problem for us. Like, the communities want us, but we can't get staff because we can't afford staff. Because when you start to build census, like, I can't go to the state government, any state agency government, and say, I have a proposal. Please give us pilot money for 1 year to build up a census for a mobile unit to go to 3 places in the state. You know, right now we're in Woonsocket, but Providence Public Housing Authority wants us to be in 2 places. We were asked to come to South County. We were asked to come to Tiverton. And I can't pay for the staff because I can't spend the money on the staff waiting for the census to build in that
Right.
particular area.
Right.
So, and I know that there's multiple barriers, but I would love to be able to say, just give us a 12-month pilot.
You know, there's got to be some innovative thinking in order to do this, because right now, if you look at the emergency rooms, it's chock full. Chock full. But if you had 4 different quadrants in the state, not all Smithfield, Burrillville, Forster can go to East Providence in that facility over there, especially with the bridge being out. Now, if you had 4 different quadrants, you gotta think to yourself that it'll take a lot of pressure off a Miriam, a Rhode Island, a Woonsocket hospitals, you know. And even if I'm a CEO of a hospital, I may want to put a facility like yours in my neighborhood to take some of the pressure off. I know it's all about money. You know, the system is broken. There's no doubt about it.
It really is.
You know,
Yeah.
and no one seems to have the answer how to get it back on track. You know, I mean, I can tell you personally, you know, I'm going through a little bit of issue right now, but you go to the doctor, you get this test, you get that test, you get this test, you get that test. I know that this test, and this test is not going to give me the answer because of the issue that I have. So why can't you just put me where I need to be? Oh, you can't do that, Mr. Tassone, because we can't bill.
That's true.
And then what happens? The system is collapsing because they're spending so much money on incidental tests where they can pay one bill on a real good test to find out what's wrong with you. So the system is broken. Let's get that right out there. It's broken. And organizations like yours have 15, 20 years. And we had to fight like dogs last session to get rate increases. And I say to people, how can you run an organization with rates that you have been given 20 years ago? And things have changed to the point where this overdose epidemic, the COVID epidemic, it's like a perfect storm.
Yeah.
And then finally the General Assembly said, you know what, you guys are right. We gotta increase the rates. Why we don't have primary care docs? They're all leaving the state. Dentists are leaving the states. Everybody's leaving the state. And me and you are hanging around.
Yeah, I know.
But I mean, something that you just built, hopefully, there can be more of those one-stop shops. And more people can access all those things, especially like DLT and SNAP and all the things that the underprivileged need, you know, is right there. So they don't have to go to Woonsocket, North Providence, Smithfield. It makes perfect sense.
Yeah.
I think that's where the hang-up is. It makes perfect sense.
Maybe.
You know?
Yeah. Yeah, it's complex here. It really is. I don't know. I know that the FQHCs have their problems, and the CCBHCs. FQHCs come from medical. CCBHCs come from a mental health perspective. One of the things that's different about what we're doing, we come from the perspective of what do you need. Just come in. What do you need?
You know what I need right now? I need to go to break.
Okay.
You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back with Linda Hurley and Kodak after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
I like it.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Linda Hurley's in the house with a big announcement today. 45 Royal Little Drive, new, complex, all-inclusive primary care, substance use, mental health, DLT, the HOPE Initiative, and the list goes on. I can't remember all of them, Linda, but thank you for joining us today.
Yeah.
So first of all, I want to congratulate you and your staff and Senator Reed, Senator Whitehouse, for having the vision to do something like this.
Yeah.
If you're in a cocoon, you never think outside the box. You have thought outside the box. You really have. And you deserve a lot of credit for it. And the board of directors for giving you the okay to go out and do it. So thank you.
Thank you, John. My staff gets tired of my vision. Well, I get tired of my vision, but it's none of it could happen without the board and the staff and the people that come to us for care. That's what this is all about.
Yeah, it's all about care. It's all about making sure you have the right care at the right time. You meet people where they're at.
Right.
Your grand opening is going to be in March.
Yes.
We will do something on the show about that.
Okay.
When you're ready to go. Because I think it only takes a few minutes to go to Royal Little Drive and take a walk through and see the efforts of Kodak and what they did. And Senator Reed, Senator Whitehouse, and the rest of the congressional staff, and the state staff too, in order to help you move the ball down the field.
Yeah.
And I think a lot of patients will be very much satisfied by visiting Kodak. So I want to thank you again for coming on. I want to thank you for your vision. I want to thank you for whatever. I'll thank you. I appreciate it.
You're welcome. Thank you, John.
You're welcome. And my next week's guest is Nicole Pagliata from Aware Recovery Care. And again, if you see something, say something. Have a great week.